Hello again, everybody. We're going to talk about several very important topics today. And one of them would be blinking. Blinking, and we'll discuss also how we work with the charts. I'll start sharing my screen with you properly. Right? Okay, as usual, a short disclaimer that this is not medical advice and you have to address all the problems with your vision with your eye doctor. Yeah. Okay. So last time we were discussing some relaxation practices which are beneficial for the eyes, like sunning, palming, alternating sunning and palming, which called sunning sandwich, sunning palming sandwich. So today we'll talk about reverse blinking and blinking, the benefits of blinking, how often we blink, and we'll discuss some work with the charts. All right, and these are future topics that I'm listing here. All right, in my practice, when I was practicing ophthalmology, a lot of people, every other person, if not every person, would suffer from dry eye syndrome. So dry eye syndrome is caused, first of all, of not blinking enough. So what happens is the meibomian glands become clogged, and they are in the part of our eyelids. So if the meibomian glands get clogged, they actually release the oily secretion, which mixes with the tears, and that provides natural lubrication. So when we blink less, they don't get massaged with the blink process enough and get clogged. So our eyes, the tear film, the natural tear film that lubricates our eyes, is getting dry. So we get redness, symptoms of redness and swelling of the eyelids. It can even cause blepharitis, inflammation of the eyelids, and this is one of the complications of dry eye syndrome. So and the worst complication if getting chalazion, it's like a pea-size tumor in the inside your lid, and you can even see it sometimes, and it can grow up to a pea size, but it can start with a smaller size. So we'll talk about so what is the common treatment and at-home release? What if you get these symptoms as I'm describing, and we'll discuss that. I just wanted to show you again how it looks on the slide, on the picture. This is healthy and normal eye, and this is the eye with blepharitis. When you start seeing little crusts on your eyelashes and redness, especially in the morning. All right, and this is more enlarged, actually, slide from the slit lab, from the examination. All right, so chalazion, and that's the clogged meibomian gland. They form a cyst. It's not a sty, because sty is a little bit something different. It's the acute staphylococcus abscess of the eyelash pocket. So it's on the edge of the eyelid, but chalazion is more in the middle of the eyelids. So it is usually treated with topical antibiotics, warm compress, mild eyelid massage, and it resolves within 3 to 4 months. If it's not resolved, usually it should be removed. And so it's done by surgery, patient surgery. So how do we prevent dry eye syndrome? So first of all, blinking. When you're at the computer, try to blink, and during the day more. Because blinking, it cleans, lubricates, and moves the eyes and refocuses the vision. It actually helps. Blinking more often helps to improve your eyesight. So what you can do if you notice that your eyes get red and dry, you can use warm compress. You can alternate warm and cold compress with a washcloth at the end of the day or during the day if you have time. That will help besides blinking. In the shower, every day we take a shower, right? So if you have these symptoms of the compiling the crust on the eyelashes, you can do gentle cleansing with the Baby Johnson's shampoo. And that would not sting your eyes, so that will help. So warmth and massage around your eyes and palming actually helps because the massage of your orbital part of the eye, so of the hard part of the eye, not without touching the eye, it actually improves circulation. So what else helps? Actually, yawning and stretching helps as well. Laughing, right? So when we laughing and crying, actually letting go of emotions, maybe I hope you're not crying too often, but it actually helps also lubricating. And one of the practices that you can try today is the 30-second blinking. 30-second fast blinking, and that will create like a disco effect. And you'll know what I'm talking about when we start doing that. All right, so I want you to try it with me, and I'm setting the stopwatch, and I'm starting right now and do a rapid blinking. Light blinking starts now. Light like butterfly blinks without squeezing your eyes. Blink, blink, blink. And you see this effect of the disco ball when you were in the disco. That's everything is blinking, everything around you. Okay, I'm doing that with you now. And you can stop. So within several minutes, maybe between a minute and 5 minutes, you notice like more tear production in your eyes, and you notice that your eyes are more moist, and it actually helps. So this is a good method during the day to get rid of the dry eyes. So you can do slow blinking as well. Slow blinking is like closing your eyes and opening during the day. Like if you're sitting somewhere, just close and open just for several seconds. That also helps, and that gives your eyes also rest and lubrication. And don't forget hydration. Hydration, drinking enough water is critical for tear production. All right, now we're moving to another topic of our day today. I want to show you the slide of the eye muscles, and you see there are 6 eye muscles that move the eyes, and they actually are one of the strongest in the body. And these eye muscles, besides the fact that they can move the eye in different direction, they can actually change the shape of our eye, because our eyeball is pretty soft, soft structure. So what happens if our muscles, some of our muscles get more tense than the other, it actually changes your refraction, changes your vision. Okay, there is another slide, just shows you so these are the muscles and the structures. So it's very soft because it is filled with the vitreous humor. It's the gel-like substance. It reminds, probably, if you can imagine the white of the raw egg, that's how vitreous body, that's the liquid that fills our eyeball. So it's pretty soft. Now we'll be coming back to the eye anatomy pictures. All right. So to understand refractive errors or different types of vision, eyesight, right? So in the shape, how our eyeball is shaping and changes the shape. So if you see the normal vision, our eye is perfectly round, and we see faraway objects well and near objects as well, very well. In myopia or nearsighted eye, it elongated. So that means the muscles, certain muscles are more tense than the other. So it changes the shape of the eyeball, and it is elongated. So faraway objects are seen blurry. And you see the focus is in front of the retina. So this is the retina, this is the normal eye, the image lies right on the retina, so that's why the eyesight is perfect, and this is in front of the eye. So myopic people don't see far. And in hyperopia or far-sighted eye, actually the eyeball is shortened. So the eyeball is shortened because certain eye muscles also, other eye muscles shorten them. They change the shape of them. And in this case, the near object is seen blurry, and the far object is seen very well, much better. So these are the main principles how we work with the charts. So you can print your charts that you have, and there are three sizes of the charts, right? Big, small, big, and medium. Big and medium charts we put on the walls, on the different walls at different distances. And you can choose your distance by just stepping closer or further from the chart. It doesn't have to be 6 feet or 3 feet away, or 20 feet or 10 feet. 6 meters, I was going to say, or 3 meters for people who understand more metric system. All right, so the checking or working with the charts needs to be done without glasses or lenses. Or if you want to check or work on your vision, it has to be at least the low prescription, but ideally no glasses. And you can stand very close to the chart as close as 2 feet, 4 feet. Just find your ideal distance where you see the lines, the next to the last line pretty well. All right. Now, how do we look at the chart? We see at one letter at a time. And central fixation or central point that Dr. Bates was explaining, I'll start talking about it, and we'll be coming back to this at every session. So if we look at the letter E, we see that the left top corner of the E is seen the best, the sharpest, and the rest of the letter is more blurry. So that is the principle of central fixation. We see the best where we look at this moment. Okay. So, and when you look at the chart and compare the small letters and big letters, you see at one letter at a time. You don't have to look at the whole chart and just see the whole chart clearly, or the whole line clearly. So we compare the letters at the big, medium, and small charts, and it depends on your vision. If you're nearsighted, you'll be looking, you'll have your control chart and goal chart. Your control chart for nearsighted people is the near chart, which will be the small chart. And your goal chart would be the the bigger chart on the wall at the optimal distance that you choose. And you compare the same letter on the small chart and the big chart, identical letter. And during the working with the charts, you have to blink, breathe, and relax. Don't stare, don't strain, and just see what you can, and without stress. All right. So, reducing the prescription could be done with a friendly optician or eye doctor if they agree to reduce your prescription. Or you can also do it online and order your glasses online. Many people do that, and it's pretty inexpensive. So you can choose the reduced prescription as your transitional glasses while you are in the process of improving your eyesight. And this is the website that I'm like several websites that I'm here showing you. You can do that, order it in the US. In the book Visions of Joy, or on the website Vision of Joy, there are more options for that. So it's a personal choice for how much you reduce the first lenses. It could be, from quarter diopter to half of diopter reduction, but no more. Just try slow reduction. And it takes usually 2 to 4 weeks to improve, at least. Of course, you reach out for help, and we can discuss that. All right. So what is Dr. Bates' suggestions on working with the charts? He suggests to read the eye charts at 15, 20 feet as well as you can in the morning and at night. And again, this distance can be even closer if you don't see well without your glasses. When you look at the chart, imagine the white spaces in letters to be whiter than the rest of the card. In other words, just pay attention not at the letters, but at the at the spaces between the letters, and letters will become more clear over time. So with this method, you're actually relaxing your accommodative muscle. Reading fine print at 6 inches, if you can, in AM and PM, morning and night, is also would be beneficial for people with presbyopia. Or just look at the white spaces as well. Okay, palming for 10 minutes daily when convenient. That was very, very helpful relaxation practices for all. So whenever convenient, also closing your eyes, as I mentioned before, for a few minutes and rest them. That will improve the lubrication, the relaxation, and it as a result will improve your eyesight and your visual acuity. All right. Again, I'm repeating the recommended book list that you can, I hope many of you already looked and started reading. And of course, I will be very happy to answer all your questions, either in a live chat or by email.